When I was listening to Anne Marie and Barbara speak, I was thinking about all of the people whom I have known over so many years who have been so brave in facing the challenges in their own lives. You know, when Anne Marie's daughter, Michelle, was sick, and it was such an incredible, unique, rare occurrence to have such a young woman with advanced colon cancer. And they were fighting to make sure she had the health care she needed. They were caught in one of these absurd kind of catch-22 situations where she was in school, which meant that she could still be on their insurance policy. If she dropped out of school because she was so ill, she would lose health insurance. You know, that kind of bureaucratic cruelty which so many families face all across our country. And thankfully, because of the response here in New Hampshire, the New Hampshire legislature passed a law which said that if you are a dependent child, but obviously an older child in school, and you are ill, you will be able to keep your family's health insurance so that you can be taken care of during your illness. And then Anne Marie went to Washington, and she walked the halls of the Capitol talking to people about this, and I was very privileged to introduce the federal version of Michelle's law in the Congress, and we're going to get it passed. And when we get it passed, it will be a great tribute, not only to Michelle, but to her mom, who has made this a cause. And so I thank you for taking that and helping so many other people. And you know, I think about Barbara and her son Josh all the time because I met her in Portsmouth back in around Labor Day. And she told me the story about her son and how many operations he needed and how well he's doing because he had the support and the real constant care from his family. But he also had access to health care. You know, having a child with a relatively rare condition that requires all those open heart surgeries is really expensive. And even if you have the best insurance in the world, it's expensive. And a lot of people have insurance that hits a limit, and then they aren't insured anymore. So back in 1997, I worked with a number of other people to create the Children's Health Insurance Program to fill a big gap that exists. You know, if you're poor enough, you're eligible for Medicaid. But if you're a working family, if you're a middle-class family, if you have insurance but it runs out, if you have insurance but when you or your children get sick, you lose your insurance, you're out of luck. And the Children's Health Insurance Program was to fill that gap, to take care of the children of people who are a lot like all the rest of us. I mean, people who get up every day, they go to work, but they don't have insurance when they really need it. And we covered 6 million children. And obviously not the same 6 million children, because over 10 years, children have grown up, and unfortunately, some of them became adults and lost access to the Children's Health Insurance Program. I've met lots of families who, just didn't qualify, even though they didn't have insurance. So we've been trying to expand this program, and it is something we've worked really hard on. And over the last several months, we've passed extensions of the program only to see President Bush veto it twice. And it just honestly is so hard to understand. President Bush has said, well, everybody in America has health care. They can go to the emergency room. And that just shows how out of touch he is with what goes on in the lives of Americans, because I don't know when the last time was you were at an emergency room, but they're packed. And they're packed with people who have no insurance. They're packed with people with insurance that doesn't cover everything they need insurance for. And they're packed with people who have a real emergency. And the result is that we have a lot of emergency rooms that are not able to keep up with everybody they're trying to take care of, because there are a lot of people who shouldn't be there in the first place. They should be seeing a doctor, they should be in a clinic, but instead the only place they have to go is an emergency room. So I appreciate, Barbara being here to talk about what it meant to have that program to help her family take care of their son. So, when I think about families in America, I think about the work I've done for 35 years, trying to create more opportunities to take care of the needs that real families have. So many families are working as hard as they know how to work, but the economy is not working as well as it used to, and a lot of people are falling further and further behind. Some workers, about 150 of them, got a really rude awakening the other day in Claremont, where their company, where they've worked, and a lot of them are older workers, is leaving. Last day in business, Christmas Day. Merry Christmas, right? And now they have no job. They have no benefits. They don't know where to turn. We have a lot of people in New Hampshire who are losing health insurance because it costs so much. I was in Milford just a few hours ago, and a woman said to me that she doesn't know what she's going to do because her health insurance, she's just been told, is going up from $1,200 a month to $1,700 a month. And that's not an uncommon story here in New Hampshire and across America. The average family policy is $1,200 a month now. That is really hard for most families to afford. So a lot of people are going without insurance, or they're deciding not to cover certain members of their family, and they're all just hoping that nobody gets sick. I think we've got to do more to help families not only get the health care they need, which is why I've proposed universal health care that will never be taken away, that would give you the chance to get the same options for health care that members of Congress get, and would give you financial help in order to be able to afford it. But we also have to look at the pressures that are on families and today's economy. I think we need to do more to expand the Family and Medical Leave Act so that families get time off when they have a newborn baby or when somebody's sick. I think we need to look for ways to try to create paid leave for some workers, because it's hard to take unpaid leave if you have to keep working, and that means a lot of people are just totally without recourse. They don't know what to do. I believe we should do more to help families save for retirement. So my American retirement accounts would match the first $1,000 of savings that someone is able to make with $1,000 from $0 to $60,000 of income, because we have the lowest savings rate we've had, since the 1920s. And when emergency strikes, that's really hard. We have a lot of families in New Hampshire and across America facing foreclosures. I think we ought to have a moratorium on foreclosures. We ought to freeze the interest rates on these subprime mortgages because too many families got lured into these, did not know really what they were signing up for, and are now facing the loss of their home. We should do more to help families save for long-term care for their family members. I'd like to see us do more to get more tax credit help for long-term care insurance, and I'd like to see us do more to make sure that there's more home health care for people that want to stay in their homes. We're lucky because my mother lives with us, and we can manage that, and thankfully she's healthy, but that's not the case for a lot of families. If someone has to go to a nursing home, let's make sure that they're the highest quality nursing homes. And the federal government has all this data on nursing homes. Which ones are good, which ones aren't. Let's release it publicly. Let's shine a bright light on the quality of care in nursing homes so that if you're having to make a decision or you already have somebody in a nursing home, you know where they fall short, and pressure can be brought to improve the quality of those nursing homes. More and more nursing homes are being bought by absentee owners, and they're just not paying attention to the quality of care that should be provided. So there's a lot we can do to help people get more assistance to take care of the most important jobs any of us have, and there's more that can be done to help families balance family and work, because it's hard. We're working longer hours. There are a lot of single parents that are working longer hours. We had a great program going for after-school care, which the Bush administration has been cutting out. So a lot of families no longer have safe, affordable places for their kids to go. And we have cut back on child care assistance, so a lot of families don't have access to that either. I don't think we should be making it as hard as possible to take care of our families. We ought to be making it easier. And that's what I intend to do. It's something that I've done for 35 years, and it is certainly something that I will do as your president.